A dentist's office is no one's favorite place to be, but a UW professor is making a link between numbing our gums and helping chemo patients. We'll explain.
Novocain could be the key to easing a small part of the pain that comes with a cancer diagnosis.
And an ingredient in that drug could stop the all-too-common hair loss that comes with chemotherapy. Only News 3's Danica Lewis spoke with the folks behind this study.
Well, Michelle and Eric, other studies already show patients rank going bald second among the worst side effects of treatment. Another says nearly 1 in 10 women would rather pass on chemotherapy than lose their hair. But a UW study hopes to help those with no other choice so they have one less thing to worry about.
I put on the blonde wig first.
When Lynn Malater set out to beat her breast cancer,
It takes your breath away.
she didn't think chemo was in the cards.
You can almost feel they feel sorry for you. And that's not what you need at that time.
In her year or so of treatment,
What kept the sun off my head?
the survivor didn't show off her lockless scalp.
Don't expect me to make a whole lot of sense if I've got my blonde wig on.
Instead,
Okay.
she found ways to cover it up and found hope for her and her hair.
I wanted it to come back curly. It didn't work.
But what she would have given
A lot.
to not have needed the hats and wigs.
To maintain a sense of normalcy would have been really nice.
Who knew you could find normalcy in Novocain?
When you go to the dentist and you get an injection, there's a small amount of vasoconstrictor that's mixed into that. And the goal is, by constricting the vessels, you keep that anesthetic at the exact site.
UW Oncology professor William Fall figured out the ingredient that shrinks blood vessels when the dentist makes our gums go numb can also keep chemo away from your scalp and keep patients' hair intact.
You essentially diminish the amount of chemotherapy that's delivered to that thin film of tissue, and that tissue basically holds all the stem cells for both the hair follicle as well as the skin, so you're protecting them.
You wouldn't need a needle, Fall says, but a topical treatment applied to the head.
Just going about their lives without some of the catastrophic issues associated with the therapy itself.
Lynn says until the study is finished,
Hold your head up.
no matter how much or little hair is on it.
There is light at the end of the tunnel, and you will come through it.
Now, this topical treatment continues to be tested. Professor Fall is hoping for some funding to push the study through that testing, but so far, he says the method has proved to be 100% effective in preventing hair loss in animals. Some pretty fascinating stuff, yeah.
It is pretty cool, and I'm just glad Lynn, an old friend, is doing well. She looks terrific.
She does, and she's in good spirits.
That's a great story. Danica, thank you.
Sure thing.